Hello, I will be recording IV insertion today. As a responsible and ethical learner, I will uphold personal integrity by not engaging in any form of cheating, unauthorized collaboration, fabrication, falsification, or any other act that compromises the integrity of my skills testing recording. I will come into my room after I have checked the orders for the IV, and I'm gonna come in, knock, perform hand hygiene. Hello, Miss Smith. My name is Sylvia, and I'm your student nurse today. I'm gonna go ahead and do an IV insertion. It sounds like you're gonna need some fluids given to you today. Do you mind, can you give me your first and last name and date of birth, please? Lana Smith, 10/20/85, and I'm gonna confirm that with your bracelet. Perfect. Okay, so what I'm gonna do is I'm gonna go ahead and do an IV like I mentioned. Are you by any chance allergic to latex, adhesive tape, iodine, or chlorhexidine? No? Perfect. And are you left or right-handed? Right-handed? Perfect. And have you, is there anything on your right hand, like have you had radiation to that arm, any inflamed lymph nodes or any lymph nodes you've had removed, or a mastectomy on that side? No? Perfect. Okay, so if you don't mind, I'm gonna go ahead and work on your left side. And since that one is not your dominant hand, we wanna make sure that the IV that we're gonna put in does not interfere with your activities of daily living. Okay, awesome. Okay, let me gather my supplies. So I will want a saline. Okay, perfect. I have my supplies ready here. I'm gonna go ahead and put on some gloves. And how's your day going today? Oh, beautiful. Yeah. Oh, these are very small gloves. Sorry I'm taking so long. These are a little small gloves, but we will definitely make this work right now. It doesn't help that my hands are sweaty. Okay. I'm gonna go ahead and put on a tourniquet, and then I'm going to examine your arm just to find a good vein. And we want to make sure that we get the tourniquet tight enough so we can see the vein pop out, but not too tight where we are fully stopping circulation. And what we want to do is we want to palpate with the index finger, and we want to find a vein that is spongy. Okay, I think I found my vein. So then I want to remove the tourniquet for now while I prepare. What I'm going to do is I'm going to clean the area that I'm going to be working with, and I want to clean in a circular motion for 30 seconds. And I'm going to let that air dry. While that is air drying, I'm going to grab my supplies, and I want to make sure that I maintain sterility while I'm doing this process. So I'm going to open up what I want to do is I'm going to hook up my syringe that I'm going to be flushing with. What I want to do is I want to loosen this up. I can also fully remove it, but if I do, I need to make sure that I'm keeping it and putting it back in my pouch since that is sterile. I want to go ahead and just flush really quick, make sure that I'm getting the bubbles out and that I'm not inserting any bubbles into my patient. Once I have done that, I will put it back in my sterile area. And I want to make sure that that's going to be ready to go. I want to have my gauze available to clean up my patient. I want to open up my syringe. And while I'm doing this, I want to keep communication with my patient to ease their nerves a little bit and ease my nerves as well. I want to grab 2 pieces of tape and have those ready. I will be using that for securing the IV at the end. Okay, so now that it is dry, I do not want to touch the area because that is clean. I want to go back and put on the tourniquet. Again, making sure that it's tight enough for the vein to pop out, but not too tight where I'm cutting circulation. Okay. What I'm going to do is I'm going to pull the skin, and I am not going to touch the area that I'm poking. Okay, Miss Smith, now I'm gonna get ready to insert the IV. You're gonna feel a little poke. If it is way too painful, you definitely wanna let me know. But you will feel a poke, a little sting, okay? And I will let you know when I'm going in. And ready? I'm going in now. Here we go, here's that poke. And I wanna wait for a blood flush, okay, and it looks like I am in. Perfect. What I want to do is I want to hold it with my index finger, remove the tourniquet. I want to grab my syringe and insert. Okay, perfect. Secure this in here. What I want to do is I want to draw back, make sure there is blood in there, and I want to push in. Perfect. So I am in. I want to wipe out any excess blood, and what I want to do now is I want to grab a piece of tape. Since I know it is flushing, it's a good IV. I want to secure my IV. I'm gonna clamp it. And now what I wanna do is I want to go ahead and secure everything. I want to make sure that when I'm doing this, I am keeping the area of the IV right in the middle, so I can see the IV and I can see that everything's working properly. I want to make sure that throughout my shift I come in and observe the IV site. I want to observe right now for any redness, anything abnormal in the arm. It looks like the IV is placed right where it needs to be, and there does not seem to be any problems. I've already clamped it, so I'm going to disconnect. Now what I'm going to do is I'm going to secure this right over here, and I want to keep it to the side. I do not want it cross over anything, so I want to make sure it's in its own place. And I want to initial time. I'm going to check in with the patient, make sure they are okay. My patient is okay. I want to make sure that they're comfortable. I want to clean up everything and dispose of in the proper spot. Any needles and syringes will go in the biohazard. Dispose of my gloves. Throw everything away. I will perform hand hygiene. I will make sure I lower the bed to the bottom level. Lift up the rail again because I have put it down to work with the IV. I want to make sure that my patient is comfortable, that I ask if there is anything else I can do for them, that I put the tray and call light right next to them. And I wanna make sure that I am documenting my IV site, document that I have performed an evaluation on the hand, that everything looks good. I wanna document the gauge of the syringe I used and the response from my patient. Everything looks good and I am all set. I will walk out, perform hand hygiene again, and be done. Thank you.